Every year, approximately 37,000 Danes are diagnosed with cancer. It is expected that about every third of us will be diagnosed before we turn 75 years old. And approximately 15,000 Danes die every year as a consequence of their cancer. The typical scenario after diagnosis is a stop-and-go treatment plan, in which a treatment will be administered to the patient, after which it is necessary to wait several months before it might be possible to observe any difference in the size of the tumor. Only then will it be possible to modify the treatment plan. But what if that could be reduced to a matter of weeks instead? That's what we're working towards here at DTU at the Department of Health Technology. We are working with ultrasound imaging, and in particular with applying special analysis techniques to break the resolution limit of conventional ultrasound images. One of the first changes in tissue due to cancer is increased growth of the vascular network, which is needed to provide nutrients for the uncontrolled growing tissue. This means that by imaging the vasculature around the tumors, it might be possible within only a few days to see either an increase or decrease in the vascularization, and based on that, be able to respond much faster with whether the treatment method should be modified or not. Ultrasound imaging has many benefits over other medical imaging techniques. However, the very best resolution obtainable with regular ultrasound is approximately 1/4 of a millimeter, which is more than 10 times larger than the size of the vasculature which we need to resolve. This resolution limit means that even when using micrometer-sized contrast agents, they will appear in ultrasound images as 1/4 of a millimeter sized spots. However, knowing that they are indeed so small, it is possible to pinpoint their location at a specific point in time to within only a few micrometers. This allows us to take multiple ultrasound images containing signals from contrast bubbles such as this one, and combine the analyzed signals to end up with a final image such as this one. At DTU, we are fortunate that we are able to control all aspects of this project, all the way from fabricating the ultrasound transducers in our own clean room at DTU Nanolab, to creating advanced imaging sequences and acquisitions using the large research scanner Sarus, which can then be analyzed in detail and improved. An important aspect of any research project is the validation of the applied methods. In our group, we use liquid polymer solutions to 3D print solid test structures with a custom-built 3D printer that allows for very precise placement of features that are so small that they are invisible to the naked eye. This gives us an unrivaled advantage when creating test structures. They can directly be used to either mimic the vasculature by printing channels as small as 80 micrometers in diameter to obtain localization maps of bubbles such as this one, or to create a known pattern of scatters placed at specific locations, which can then be tracked and used to quantify the precision of our localization algorithms. All in all, we have a unique opportunity to take this project all the way from the very first idea of a new transducer, all the way to eventually test the advanced transducers and algorithms on humans. Eventually, we hope this will prove to be a useful tool in treating cancer, which will ensure not only that more people survive, but also that the entire treatment plan will become more efficient and successful.